Hi, this is Dr. Donald Pelto. I want to talk a little bit about bunions today. Bunions are a condition that is actually caused by a kind of a separating or a moving of the big toe joint over to the side. And you can see how the toe kind of pushes over to the side. And sometimes the second toe, as you can see over here, goes up on top of the bunion. The bunion's the bump, but it's actually a little bit more involved. So let's look at what can cause it. A lot of times it's caused by parents or family. That's hereditary. It can be caused by a mechanical instability or an unstable foot with a tendons pulling harder on one side than another. This can be due to a flat foot or a foot that has too much movement in it. You can see sometimes these tendons right here can pull over to the side too much and kind of weakening this side over here. It tends to get worse over time, and sometimes it can contribute to poor shoe choice. How do we diagnose it? We usually get x-rays. We like to look at an angle between the bunion. So here's before and after surgery. You can see this large angle right in here. This is called the first intermetatarsal angle, and this is quite large, and it needs to be brought back over. What I like to say is these two little bumps right here, these are called your sesamoids. And I like to try to move this bone, this head, over the top of those sesamoids, as you can see here. You want to reposition them. And by shifting it over, you can move it over and then remove the bump. Just removing the bump itself isn't enough. You need to actually correct the bony deformity. And depending on the type of the bunion, you may go further back. The further back you go, the less you need to correct. Okay, so if you go back here and take a little wedge of bone out, it really shifts the whole thing over. So initially we get x-rays, we talk about non-surgical and surgical options, and the key for children or younger people, you want to wait till their skeletal maturity has happened. Some of the non-surgical treatments, you can try icing the area. That can reduce any inflammation. You can try Motrin or ibuprofen or any of the other anti-inflammatories. That can help with any of the pain inside the joint. There are some shoes that are more accommodating for bunions, like this gel Cayano. Here's an example right here. It actually has some lacing that's more on the side, so you can allow the joint to move better. As well, a lot of times you have to be careful. If there's any seams on the side of the shoe, that can push onto the bunion area. Some types of pads can help. Here's an example of a bunion pad. This is more just to cushion the side of it. There's different pads to separate it. That helps realign the joint. And this is more for the second toe to help realign the second toe. These are called smart toes. These are actually used to hold your toes in the proper position, but you have to have actually a nice squared tip shoe or a wider shoe that can work with those. A minimalist shoe tends to work well. If someone is having a lot of pain, we can do a cortisone injection in the area that can reduce the inflammation. Occasionally they get big and red and painful on the side of the bunion, and that can be from a painful bursa or a sac of fluid that can form. Orthotics can be helpful to reduce the abnormal movement. It increases the movement of the big toe joint, so we can do a cutout right here to drop the big toe joint down and help it to move better. And a lot of times it can help reduce the progress and provide support to the foot. So we don't want the bunion to get worse, and even if it is corrected, we can help it to hopefully prevent from coming back as much. Let's look a little bit about hammer toe surgery. A lot of times we do the bunion and the hammer toe as well. There's a difference between a hammer toe, which is just at this joint right here. This is the proximal interphalangeal joint. By taking out a little section of the bone, we can straighten that out. Some people actually have a claw toe, which is kind of towards the tip of it, where this joint is bent over, and we can straighten that out. And then there's a mallet toe, which is just right at the end, and we can take out a little portion of the bone. Occasionally we have to fuse them, and that's using actually a wire to go right down. So depending on your toe type, the hammer toe is recommended to be treated. I had a patient the other day that had a hammer toe and only wanted the hammer toe, but the bunion was so close by we had to fix the bunion as well. So you can't just fix the hammer toe if the bunion is pushing it over. It's going to come right back. A lot of times we have to use a wile osteotomy as well. All that is if someone has pain to the front of the foot, we can shorten the bone slightly and put a screw in it. And that just helps reduce the pain. So that would tend to be, if you're looking back here, someone that would have pain underneath the second bone. And it's usually, if you look at the x-ray, it's because there's a long second metatarsal, if they have the bone that's longer, and I'll show you here. So if someone had this bone right here, this is the second metatarsal, if it's very long, that would cause a painful bone area under there, and we could shorten that bone with that wile. So once again, here's an example. The angle that we measure before and after the surgery. This is more of a scarf, bunionectomy, where you actually cut along the whole length of it. This is an Austin bunionectomy, and there's a little video here, you can watch it. Here's a bunion bra, I call it. It's just to hold things in place after surgery. This can be helpful to hold the hammer toes and the bunion in proper position. There's the scarf bunionectomy. This is where 2 screws are used, and you can shift the whole thing to the side. This is done for more of a larger bunion, and it's a very good procedure to move it over. And then there's also a lapidus bunionectomy, which actually causes a fusion here down in the bottom, and by moving the bunion over. If you are interested in surgery, I do have another video for surgery preparation that can go over all the details. If you'd like more information, at drpelto.com there is something called a foot pain toolkit that you can sign up for. Just put your email in there. It sends out a lot of information to you about bunion surgery and different types of foot conditions.